Hello everyone, this is a video on subthreshold laser treatment for retinal pathologies, and we're going to be talking about the mechanisms and advancements behind this technology. Subthreshold laser therapy has regained interest in recent times with advancing technology and newer delivery systems. Recent clinical trials and inclination towards retinal restoration therapy is bringing subthreshold laser therapy to the forefront of treatment options for many retinal disorders. This video critically reviews the merits and challenges with available subthreshold laser delivery systems and reports advancing clinical applications. We aim to showcase subthreshold laser for diseases such as central serous chorioretinopathy and diabetic macular edema, as well as discussing more recent applications of subthreshold laser for other diseases such as glaucoma. We also clarify common, long-standing questions about subthreshold laser therapy and provide practical tips for clinicians on this advancing technology. Let's first talk about what subthreshold laser therapy is. In this image, the yellow rectangles on the graph show the on periods for the laser, while the orange curves show the heat profile of the underlying tissue. The graph goes from a 5% duty cycle, shown on the top, to a continuous laser, shown on the bottom. The technology has been labeled with several terms, including sublethal treatment, subthermal, homeotrophic laser, subthreshold laser, subvisible laser, retinal phototherapy, and microsecond laser. The technology for subthreshold lasers has been around since the 1970s, with the first paper on this technology titled Retinal Damage from Repeated Subthreshold Exposures Using a Ruby Laser Photocoagulator, published in 1970. The study found that 0.5 millisecond laser pulses with an energy density of 375 microjoules per square centimeter did not lead to independent damage, but rather had a cumulative effect. The technology has developed since then, and subthreshold laser has been clinically used since 1997. As opposed to conventional lasers, subthreshold lasers do not produce observable evidence of damage to the targeted tissue. The goal of treatment is to achieve the same therapeutic effects of conventional lasers while minimizing damaging effects such as scarring, tissue atrophy, undesirable neovascularization, and vision loss. The term subthreshold has been used to describe multiple techniques, including nanosecond laser pulses, microsecond laser pulses, and decreasing the power of the laser. Current research has been focused on microsecond pulsing laser. This video demonstrates a microsecond pulsing laser with the ODOS Navilas laser system. Microsecond pulsing is defined by breaking up a continuous wave into multiple consecutive bursts, known as a micropulse. Each short pulse, or on time, is followed by an interval, or off time, which allows the tissue to recover. The ratio of on to off time is the duty cycle. The most commonly used duty cycle for subthreshold laser ranges from 5 to 15%. Now let's move on to the long-standing questions and answers about subthreshold laser therapy. First question is subthreshold laser the same as subvisible laser? This is an excellent question. While similar, these are different. Subthreshold is defined as photocoagulation that has not reached the endpoint and has the outcome of invisible burns without structural damage on clinical exam and available imaging modalities. Subvisible laser is when the photocoagulation has reached its endpoint without evidence of burns on clinical exam and imaging modalities. The next question is, can subthreshold laser be applied over the foveal area? Yes, with correct settings of 5% duty cycle and 30% of subthreshold laser power, subfoveal subthreshold laser can be applied without causing any damage to the retinal tissue. Multiple studies have shown its safety over the foveal area. However, it is still necessary to be careful about the settings. The next question is, can you repeat subthreshold laser at the same area? The answer is yes. Subthreshold laser can be applied to the same areas with minimal risk for any complications, as long as the appropriate safe settings are used. Devices like the Navilas 577S system provides detailed reports marking the lasered areas, which can be useful in planning a repeat laser treatment. In this next section, we will be discussing subthreshold laser systems and their advancements.
There are numerous companies that offer ophthalmic products with subthreshold laser capabilities. Iridex is one such company that has been making subthreshold lasers since the 1990s. The company currently offers the IQ532, IQ577, and Oculite SLX models with their patented micropulse technology, which can be used for retinal diseases as well as glaucoma procedures. They also offer the Cyclo G6 glaucoma laser made specifically for glaucoma procedures with subthreshold microsecond pulsing. Finally, Iridex offers the Pascal synthesis line of lasers, which uses pattern scanning and endpoint management for retinal diseases, as well as their pattern scanning laser trabeculoplasty for glaucoma. ODOS is another company which has been making lasers since 2008. They offer the Navilas 577S Prime and Pro models, which provide subthreshold solutions through microsecond pulsing for both retinal disease and glaucoma applications. The Pro offers a more affordable option, while the Prime includes recording capabilities and importing of external images. Both devices also come with the ODOS's patented Retinal navigation system, which enables streamlined live imaging, planning, and documentation. Quantel Medical is another company that has been well established in the ophthalmic device market since their founding in the 1990s. They offer the Easy Ret for retinal applications, which uses their subliminal technology to achieve subthreshold effects via microsecond pulsing. This device also comes with the fiber laser, recording capabilities, a touchscreen interface, and pattern recognition. Additionally, the company offers the Vitra 810 that can perform subliminal laser for glaucoma procedures, and the Optimus Fusion, which allows SLT, YAG, capsulotomy, and photocoagulation, all which can be performed from a singular device. One of the oldest medical laser manufacturers, Luminous, also offers a few subthreshold laser products. Their Smart 532 system uses their Smart Pulse technology, which is similar to that of microsecond pulsing. The device can be bought as a standalone unit or with Luminous's ArrayLink, Selecta Trio, or Digital Trio. Both the Selecta and Digital product lines also offer SLT and capsulotomy for anterior procedures. The Digital product line also offers recording capabilities and documentation. Alpha Ret is another laser company that was recently established in 2020 to take over the 2RT retinal rejuvenation project from LX. 2RT offers subthreshold laser via nanosecond lasering using short 3 nanosecond bursts at 532 nanometers. This technology is still undergoing testing and FDA approval.
Subthreshold laser therapy is on its way to developing into a standard for retinal restorative therapy for various retinal diseases such as CSCR and DME. Clinical studies are being done for evaluating its role in age-related macular degeneration and polypoidal choroidal vasculopathy. Paradigm shift from retinal destructive to retinal restorative therapies is very encouraging. We hope this video was able to provide a fundamental understanding of subthreshold lasers and their bright future in treating ophthalmic disease. If you have any comments or questions, please send us an email seen below. Thank you for your time.